To order the St. Lawrence County Board of Legislators meeting for Monday, May 4th. Roll call, please.
Reagan. Reagan. Forsythe. Dave Forsythe.
Here,
There we go.
I'm here.
Sheridan. Sheridan. Can they hear me? Sheridan.
Sheridan's here.
Buck.
Here.
Leader. Are we up there?
Here.
Denisha's here. Perkins.
Here.
Akers.
Here.
Fay.
Here.
Haggard.
Here.
Arquette.
Here.
Burke.
Here.
Arquette.
Here.
Terminelli.
Here.
Curran.
Here.
14 present.
Thank you. Mr. Denisha, would you lead us in prayer, please, followed by the Pledge of Allegiance?
Thank you, Chairman. Dear Father in heaven, we're grateful for the opportunity to come together this evening, although at a distance. We pray for those who are caring for the sick. We pray for their health, that they may not fall ill. Scripture tells us in the words of Luke 6:38, and I quote, "For the same measure that ye give, it shall be measured to you again." Father, we ask that you protect all caregivers, first responders, and medical personnel against the germs of COVID-19, and help those who are giving unselfishly of themselves to be protected as they nurse others back to health. Grant our leaders the strength and courage to make the best decisions during these most difficult of times. Grant us the wisdom to have faith in our leaders as well as one another, and to know that this pandemic will pass. For all these things, we ask your blessing through your Son, Jesus Christ, through whom all things are possible. Amen.
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 I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Mr. Perkins, you were going to make a motion to suspend the rules, I believe.
Yes, I'll make that motion.
Is there a second? Second by Ms. Terminelli, Mr. Akers, and Mr. Arquette. Any discussion? Seeing none, all in favor?
Aye.
I,
Opposed? Any opposed? It's carried. Right to the presentation of resolutions is the resolution appointing Margaret Haggard to the vacated seat of the St. Lawrence County Board of Legislators, District 10. Is there a motion to move this resolution? By Mr. Arquette, seconded by Ms. Terminelli and Ms. Arquette. Any discussion? Seeing none. All in favor?
Aye. Aye.
Any opposed? Carried. Can we proceed with the swearing in, please?
Okay.
I, Margaret I, Margaret I. Haggard,
I, Margaret I. Haggard,
Do solemnly swear
do solemnly swear
that I will support the Constitution of the United States,
that I will support the Constitution of the United States,
the Constitution of the State of New York,
the Constitution of the State of New York,
and that I will faithfully discharge the duties
and I will faithfully discharge the duties
of the office of St. Lawrence County Legislator
of the office of St. Lawrence County Legislator
to the best of my ability.
to the best of my ability. Thank you very much.
Congratulations.
Thank you.
And we'll take a couple of minutes while Margaret signs the book, and then we'll return.
Thank you.
See you folks later.
Bye.
I gotta go back to work.
There you go. With Mrs. Haggard, she would like to make a statement.
Thank you, Mr. Chairman and fellow legislators. I'm honored to have been asked to represent the people of District 10, and I look forward to serving my home district. I would like to urge my constituents to contact me with any concerns, questions, or ideas. At this time, Mr. Chairman, for the record, I will be recusing myself from any matter to include discussion and voting regarding the Department of Social Services or its employees, either directly or indirectly, that come before this board. This is because of a personal relationship with an employee of the department. Thank you very much.
Thank you, Mrs. Haggard. We will move on now to a update on the COVID issue with Dr. Williams and Dr. McGuire. Dr. Williams, would you like to go first?
Sure. So good evening, everyone. Just a brief overview. Right now, we stand at 185 cases. This represents an additional 57 cases since I last presented on April 20th. The overall trend is actually quite favorable. So for the past 14 days, the average was 5.2 cases per day. But for the past 7 days, we've had only 1.7 new cases per day on average. We still do have quite a few more cases than our surrounding counties. So if you look at Franklin County, they only have 15. Hamilton has 3, Herkimer 62, Lewis County 9, and Jefferson County 62. We have done quite a bit more testing. Since my last presentation, our current total is about 3,640 tests have been done. I'll mention that this is slightly different than what the state is reporting, having to do with the communication between our local lab and the state, but we've done quite a bit more testing than the other counties. Right now, we've tested about 3.2% of the population of the county, and the percentage of positives is 7.9%. While we're talking about testing, there's been some updates. So there's both new tests that are available and a new strategy for testing. So we continue to have the PCR test, which tells if someone has an acute infection. But now there's also what's called serologic testing. And the serologic testing is a blood sample, but it has just a fairly limited and a fairly specific role. The serologic testing can tell whether a patient previously had the infection. However, despite initial hopes, it doesn't necessarily prove that somebody is immune. And really the main role, I think, for the serologic testing is to give a sort of a sense of what the prevalence of the disease is in the community. For an individual patient, it just tells you if you've previously been exposed to the illness, but it doesn't tell you if you have an active infection or not. The other big change is that New York State Department of Health issued new guidance on the 26th of April that basically added 2 other priority levels for testing. So previously the focus had been on testing symptomatic individuals, either in the hospitals or nursing homes, or symptomatic individuals who had had a contact with a known case. But they added priority 3 and 4. Priority 3 is the asymptomatic healthcare workers, and also first responders and essential staff who are in congregate settings. And then they added priority level 4, which is actually asymptomatic, essential, but non-healthcare workers. So pretty much anybody who interacts with the public as part of their profession. And they actually listed 28 different kinds of employees. So the shift really has been to do screening of essential healthcare workers, which would be priority level 3. And so Dana and I have helped to coordinate testing of nursing home staff in the area. And also some of the hospitals are choosing to test their staff. So that's been a big focus. One of the concerns is with this much broader category of who can be tested. We're looking to New York State Department of Health for some assistance. They've already offered assistance in testing nursing home employees. And we hope as we shift over to priority 4 that they'll be able to help with maybe drive-through testing sites and some other options. I did want to just go over in terms of the trends for the epidemiology. As we all know, starting back in March, we had an initial fairly rapid increase, which was alarming. Then we kind of moved into a sort of steady growth. But again, in this past week, we've had really a significant decrease in the number of new cases, which we hope is sustained. This decrease in new cases actually comes in the context of significant expansion of testing. So it's even more meaningful. We are still in what people would call a propagative stage of an epidemic up here. So we're able to connect, we're able to connect the dots between cases. There's still no documented community-wide spread based on the current testing that we have. And we also have done now a fair amount of serologic testing, which I mentioned before. And based on that testing, there's really no evidence of a high background prevalence or lots of undiagnosed cases. I did want to just share a couple of graphics, which I think also help explain some of the conversation we're going to have concerning reopening. Are people able to see the screen with the where it says transmission groups?
Yes.
So if you recall, we had talked about there being 4 basic transmission groups, which are interrelated. So there were people who travel from high prevalence areas back to our community. Then there's transmission in group 2, which was social gatherings. So people who are at restaurants and bars before the pause order, and also family gatherings. And then group 3, which was transmission within a family. And then group 4, which is essential workers and their congregate residents. And this next graphic basically just illustrates the fact that all these groups are sort of, interdependent, and the transmission can go from one group to another. But that at least initially, it was people who are coming from outside the community, which is the nature of a novel illness. One of the questions that's come up is looking at our community and why it might be different than some of the other surrounding counties. I did want to just show this pie graph, which shows that while travelers were maybe the initial group, they're only 13% of the people who've been diagnosed. A little bit more with social gatherings and a little bit more with family. But the essential workers and people who are in congregate settings actually accounts for 48% of the cases that we've defined. It still begs the question of, despite what I would call advanced and aggressive public health measures, as well as early implementation of social distancing, contact tracing, quarantine, and isolation, we still actually have triple the cases of our most comparable neighboring county, and we have more cases than the contiguous counties combined. So as Dana and I are sort of trying to figure this out, I did come across this index. So the Cornell University has something called the Cornell Population Center, and they came up with an index, which they call the Demographic Vulnerability Index. And this was a way to basically determine which communities were at greatest risk based on demographic characteristics. And St. Lawrence County came out number 4 in the entire state. And that was based on the 4 criteria that are listed. So it's the percentage of people who are older than 80, the percentage of households which are multi-generational, the percentage of congregate housing settings, and the percentage of disabled individuals in a community. And what you can see is that Jefferson County, which is white in the graphic, while we were number 4 out of 62 counties, they were number 60 out of 62 counties. So really just sort of suggesting that there are some characteristics of our county that probably led to an increase in the incidence and prevalence of the disease. So there are a number of upcoming challenges, and I think clearly the new focus is going to be looking at the process of safely reopening our region. Nina's going to speak to this a little bit more, but as people are probably aware, the governor did put out a 12-point reopening plan. There are criteria that a region needs to meet in order to reopen. And then the 12 points kind of speak to the different, both the criteria for reopening, but also how to prioritize what to reopen. And so, the first criteria is that the region needs to experience a 14-day decline in the hospitalization rate before there's a phased reopening. Reviewing the data in our county, I think we do meet that criteria. It's a regional criteria, so there will need to be ongoing discussion with our regional hospital leaders in public health. The other issue was prioritizing industries for reopening, and I know there's been some discussion about this. The idea is that there should be phases of reopening with a first phase and a second phase and a third phase, and that's based on the risk level of the industry and also how essential the industry is. The next thing was talking about business precautions. So looking at making sure that employees were protected by making physical changes to the workspace. Then the fourth thing was building healthcare capacity, which is something that's quite critical. They use a criteria of you must have 30% or more than 30% of hospital beds and ICU beds available, including after elective surgeries resume. And elective surgeries are another hot topic that's been talked about. As far as the fifth one, which is a testing regimen, so that really speaks to the importance of being able to have the capacity to do the testing that needs to happen and to be able to prioritize the groups that require testing. The sixth thing is tracing system. So the Department of Public Health has worked very hard to train people who can do contact tracing. And there's discussion about isolation, regional coordination, telemedicine, teleeducation, and then finally talking about making sure there's appropriate PPE for essential workers. Dana does have some slides, and I think she's going to review some of those shortly. So I just wanted to summarize, by saying that basically over this past 2 weeks, we've had a significant decrease in the number of new cases. And this is occurring despite the fact that we've had a significant increase in testing. So even though we're casting a bigger net, we are fortunately catching fewer fish. There continues to be a lack of community-wide spread. And I would say that this is really a testimony to the efforts of Dana and her team at the Department of Health, all the folks in the EOC staff, Ruth with her leadership as the administrator, and also to the community, because people, this has been a community effort with lots of sacrifice. There's a plan for reopening that's underway, but I would just point out that there's been significant sacrifices really across the community that we're all aware of. And I think there's no reason to squander those sacrifices and the gains that we've made by having anything that would be like a chaotic plan. So I think following the sort of 12 points that have been laid out is pretty sensible. And, you know, just to remind people that until there's a vaccine or effective treatment, the emphasis still needs to be on prevention, detection, and containment. And the primary focus of public health at this point in the local hospital systems is going to be to make sure that we've got the capacity for testing, and that we can really do the tracing and contact control that we've already been doing. And also, I think, determining what thresholds there are going to be put in place so that we know that as we reopen, that we can sort of assess whether we're successful in safely reopening or if there's reason to backtrack or at least intensify public health measures. So that's an overview. I don't know if anyone has any questions or if, otherwise, I think Dana's going to speak next.
Does anyone have any questions?
Yeah.
Mr. Akers?
Thank you, Mr. Chairman. Dr. Williams, any idea, it's probably too early to tell, about the actual morbidity of the actual virus itself? I mean, initially we were talking about 3.7%. Does that number come down with statewide or nationally?
So, I mean, the numbers are I guess I would say are variable. I mean, I think for a particular demographic, so as we know, for the elderly, for people who have lots of comorbid illnesses, there's a certain mortality rate. For younger people, we continue to see that most younger people have a mild version of the illness. So there's an overall percentage rate, and I think there's demographic specific percentage rates that are important. And in particular, when you look at a community like ours, and if you look at our demographic vulnerability, it's quite high. There's actually a second slide, which I didn't show, which is the morbidity vulnerability, essentially. And we're not as bad off as other counties are when you look at that graphic, which I could share offline.
Well, our health systems must be doing a great job because we've only had 2 deaths so far attributed. So
That's right.
Hats
So
off to your folks.
There's been very, very aggressive care. And I think, but again, it does start with public health. So I think because, and I don't want to speak, too soon, but we've worked very hard to try and protect the most vulnerable in our community. And so far, so good. And I think moving forward, we just have to keep in mind that we've been fortunate that all the hard work has paid off, and the most vulnerable in our community have not been affected on any kind of widespread, to any widespread extent, but we have to continue those efforts on some level.
Okay, thank you.
Mr. Forsythe?
Thank you. Thank you, Dr. Williams. Couple questions. Serologic testing. Where and how would someone schedule? Where are we conducting them, and how would you go about getting an appointment?
So so St. Lawrence Health System is offering serologic testing. It can be, or it would have to be ordered through a primary care provider.
Okay.
My understanding is that Claxon Hepburn is also able to run the lab, also if it were ordered by a provider. So unlike the testing centers are not doing the serologic testing, they're doing the nasal PCR, and they may be switching over to a saliva-based PCR.
Yeah. And would you are they encouraging that type of testing?
So, not so much. So there was a lot of media and, just general attention to the serologic tests. They're interesting in that they can help somebody confirm that maybe they had the infection in the past. Initially, there was great hope that you could almost have, people were calling it like an immunity passport. Hey, I had COVID, I'm not going to become infected again. And then suddenly there have been increasing reports that people who've had COVID may develop a second infection. And there's some more studies coming out that Columbia University published something that showed that people with the more benign form of coronavirus that causes a cold will actually have the same coronavirus infection several times during the same winter. So we had a lot of enthusiasm about the serologic testing. I think at this point, its main role is to if somebody just wanted to know, hey, I was really sick in February, maybe I had coronavirus, it can show evidence of that. But I actually think it's more helpful to people like Dana and me in public health, where we can tell what the background prevalence is. So like in the study of the 3,000 people in New York that New York State Department of Health did, that's where they were able to say that in New York City, the prevalence was somewhere in the 17 to 20% range, whereas in the rest of New York, north of Westchester County, the prevalence is 3.6%. So it's kind of more helpful from a public health perspective than really from an individual's perspective.
Okay, and then just one follow-up, if I could,
Go ahead.
Mr. Chair.
Go ahead.
Under the reopening plan, Dr. Williams, you mentioned travelers. St. Lawrence County tourism is a hot topic, especially from here through the next 4 or 5 months.
Sure.
Have we given consideration to limiting who can travel here? Any, from hotspots? What is the plan of any?
Yeah, I'm not sure it's not a question I can answer per se, other than to just suggest that any plans that are made on a county level, I think we have to take into consideration the fact that there are areas where there's, high transmission rate of this illness. We still don't have community-wide spread here. And so whatever sensible measures can be put into place, whether it's just encouraging people to self-quarantine or other measures, but I'm pretty sure that there's not much more that we can do other than just kind of inform the public.
Okay, thank you.
I have a question. Okay, sorry.
Ms. Haggard.
Thank you, Mr. Chairman. Dr. Williams, in my district, around the corner from my house is 49 Lawrence Avenue. And I walk by there almost every day. And I've noticed that there's hardly anything going on in that tent that's positioned outside. Is that because of lack of tests, or is it because of there's not a high demand for a drive-through testing site at this time?
So a couple of things. So first of all, even though there's a tent and we do the testing while people are in their car, it's not, what you would consider truly a drive-through testing site. So like New York State has set up drive-through testing sites in other parts of the state where my understanding is you can actually literally drive up and answer some questions and then have screening done. Right now with St. Lawrence Health System and with Claxton Hepburn Medical Center, they have a respiratory hotline. It's really essentially by appointment only. So people call ahead of time, make an appointment, drive up in their car and have the test done. But it's not really a screening site for the general population. That is, however, the direction I think we'd like to move. And especially as you look at the new recommendations for testing of priority 3 and priority 4, we have some healthcare organizations here who have hundreds, if not 1,000 employees, and our current testing centers are really not equipped to do testing on that scale. So we've been in some discussion with New York State to essentially request that they come and provide that more widespread, larger scale screening.
Thank you.
Mr. Denisha.
Thank you, Mr. Chairman. Dr. Williams, obviously there's been a lot of discussion in regards to developing a vaccine, and I guess one of the things, and this is just anecdotal evidence, I guess, that there's only 50% of the population that takes advantage of the current vaccine for flu shot. If we've only got 50% of the population that's taking advantage of the flu vaccine now, and we do develop a vaccine for the coronavirus, how are we going to, and especially given how contagious it is, how are we going to get the other 50%?
Well, I didn't list that as one of my challenges or one of our challenges from public health, but I would say that will clearly be one of our challenges. I think, because it's the novel coronavirus and because there's lots of information currently available. I think there'll more likely be increased buy-in by a greater proportion of the population, I'm hoping. I think it's going to be a challenge, though. I think it'll be important for us to help educate people about the efficacy and safety once it's available, and also to talk about social responsibility. Sometimes somebody has to take possibly a little bit of risk upon themselves in order to protect their neighbors and protect the vulnerable in our community. So I feel like that's an important part of the messaging that has to get out there, that sometimes it's, if you're 21 and otherwise healthy, you're protecting your grandmother. And that will be part of the messaging that I'm sure we'll put out, when a vaccine is available.
Okay, thank you.
Mr. Burke?
Dr. Williams, given your current public health assessment, do you have any specific recommendations as it relates to reopening or expedited reopening? Any thoughts on that?
So Dana has a little bit more information that I think came out this afternoon about, Dana and I were both looking at the initial phases that were described, and there wasn't a ton of clarity in terms of what what phase 1 meant, what phase 2 meant, what industries we're talking about, what we're not talking about. I'm gonna defer your challenging question to Dana, but she does have some more information that I didn't have a chance to review. I would say that whatever we do obviously needs to be a balance between strengthening and rebuilding our economy and the safety of our community. Those two things are not mutually exclusive, right? So if you do this the wrong way, even though you might get some temporary economic gain, ultimately, if we get some huge second wave that we were able to avoid in the first place, that's not going to help economic development. So that's just a general principle I'd put out there, that the economic issue is obviously intensely important, but doing public health properly will actually help us restart and stay restarted. My biggest fear is that we do something untoward and end up having to really shut things down 2 months from now, because now we have thousands of cases. That would be a disaster. I'd rather be thoughtful about it, have everything in place, move forward at a steady pace, but not create some sort of environment where we end up having to do something even more drastic than what we just did.
Thank you.
Mr. Quett?
Thank you, Mr. Chairman. Dr. Williams, my question to you is the testing for the coronavirus, there is no charge for, but for the serology testing, do you know if there is a charge for that?
So it's an excellent question. And I had 2 providers just contact me about that this afternoon. I don't want to say one way or the other for sure, because I was actually just trying to confirm with the local hospital systems. And like anything else, I would encourage people before they had any test, including this test, to try and check with their insurer or their provider. There's certainly a big effort and an intention to try and make COVID-related testing at no cost to individuals. I just don't want to say for sure until there's a little more clarity on this. The whole serology testing, as we know, is brand new. So I think people are both trying to understand how to use it, and then also how to cover the cost of it.
Thank you very much.
Yep.
Anyone else for Dr. Williams? Thank you, Doctor. We'll move on to Dr. McGuire.
Hi, everyone, and thanks, Dr. William, for a nice kind of summary of what we've been working on. Just to give a quick update of what the department has been up to. So we do have just 185 cases. We have 176 people who are in quarantine or the isolation process, and there are like 55 people who are in isolation. So those are the positive people who are still just in the isolation process. We've been working hard with the adult homes, with the nursing homes, and with the group homes. And this past week, we've heard from the state that they want us to partner with the nursing homes and 2 of the adult homes in the county so that they could get testing for the residents and the staff. So we are currently talking just to these agencies now. We still continue to receive new guidance as it goes on, and so things change quite frequently. And some of the new changes and the amount of time that you're on isolation for when you're positive. And so for anyone who is a resident at a nursing home or at a group home, the days since the symptoms started is no longer just the 7, it's now moved to 14 that you stay on the isolation. And that's also the same for a nursing home staff member. So if you work at a nursing home and you were positive, you also have to stay just in isolation for the 14 days since the symptoms started. And that still goes for that you need 3 days being just a fever-free without medication, and then all of the other symptoms have to be greatly decreased. There is also new guidance from the CDC that we haven't heard from the state yet, that for anyone, it's no longer going to be just the 7 days. That's going to be moved to the 10 days. And you might just recall that when I first started talking about when somebody gets to leave the isolation process, that a lot of people call it that, like you're in the recovery phase. And I just wanted to be careful on how we talked about that. And so with the research that has happened, CDC does want to increase that from the 7 days to the 10 days from the time that the symptoms started. So we are waiting to hear what the New York State is going to say about that. The last thing is we've been doing just a lot of the contact tracing. So I am going to talk a little bit more about the factors that we will be using when we can do the reopening. And so I have been doing some of the training with some of the other county employees. We have some of the volunteers. We're supposed to get up to 35 tracers for the county, and we have about 18 now, and I have 3 training sessions. We will be pretty close by the end of the week. So that's what we've been doing. I have some slides to share, so I'm going to see if I can do this right here.
Any questions?
And can you see the slides on your screen?
Yes.
Okay.
Yes.
So this kind of does a nice kind of a summary of what Dr. Williams talked about. So there's 4 main factors. We have to work just as a region, and we're the North Country region. So there are 7 counties. We met for the first time last Friday, and these are the factors that they're using to see when so as it was mentioned, for the new infections, we must have a 14-day decrease in the hospitalizations and deaths. For the healthcare capacity, we have to have at least 30% of hospitals and ICU beds to be available. And hospitals have to have at least 90 days of the PPE in stockpile. For the diagnostic testing capacity, we have to be able to do 30 tests for each of the 1,000 residents per month. And so that's really trying to maintain what we've done in this first few weeks. I think we've been at like 7 weeks. So, but as we've started to ramp up, you know, this is more of the that we would have to do testing for. And then as I mentioned, we'd have to ramp up the contact tracing that we're looking to have 5 of the tracers. We talked a little bit about the business safety plan. As we think about trying to open up just the business that we have and what things need to be in place, we have to just try to like reimagine what we did before, trying to think about the hours and the shifts, still the non-essential travel, the social distancing protocols, mask wearing, cleaning, keeping that all in place just to keep the employees safe and then the people who use those kind of businesses. And then lastly, this was the first day that I really saw what types just of the businesses would be in each phase. So we kind of knew about the construction and the manufacturing, but phase 2, phase 3, and phase 4 have now been listed. And so you can see them listed here. I know we talked about all the travel that happens this summer and what you'd see here for St. Lawrence County. But we're really supposed to try to avoid all the things that would be like an attraction and that would gain a lot of people to come here to the area. So as I mentioned, we talked just as the directors of the 7-county kind of North Country region last Friday. And we will be meeting on a weekly basis to talk about things and to make sure that we're kind of just trying to move in sync with what all we have. And so while we have some of the sameness, there's a lot of differences that we see in our region. So we'll just be working together to try to meet all of the needs that we have. And so that's all I have. But if you have any questions for me, let me know.
Any questions? Okay, Mr. Arquette.
Thank you, Mr. Chairman. Dana, at the onset of this, the tests were given exclusively to folks that were symptomatic. Does that remain the case?
No, it does not. So when we get the contact list for the index case that we're looking at, we actually, we do a referral to all the contacts now. So, and many people may or may not have the symptoms. So all of the contacts that we see, we do refer. Not all people take that, but we do the referral. And then our office has been trying to promote that all of the essential workers do get testing if that's what they'd like to do.
Great, thank you. And thank you for all you're doing.
Anybody else? Mr. Forsyth, followed by Mr. Akers.
Dana, can you hear me?
Yes.
Okay. Under the screen, the 4 core factors for the startup. How do we get much better than what we are now? The death rate is low to non-existent. The hospitalizations are low to non-existent. How do we get decreases from that?
Well, so the one thing to keep in mind is this is for like our region, not just our county. And so, yeah, so
But I'm basing, is our region basically the 6 surrounding counties? Is that considered our region? Because I think the last I looked, we had more cases than the rest of the 6. So,
yep. So I think for this criteria, I think that we're doing fairly well. It also says that we cannot exceed 15 net new total hospitalizations, and so we've never been that high either. I don't believe, and so I think that that's an area that we're doing well in. But of the healthcare, the capacity for the PPE and things. I think the hospitals have been fine, and maybe Dr. Williams, you can talk about that, but we've been working on that for like and all of our other partners. And we've had quite a while without gowns and without N95 masks. So that would be an area that I would be kind of concerned of. And I'm not sure how the other regions are kind of faring just in that area as well. So I think all 4 factors are kind of considered. And I don't know if they're all going to be kind of weighted the same.
okay, and on to the follow-up question, if I can, Mr. Chair. The business safety precautions, the most recent cases you've had, say in the last week, had they been following the wearing the mask, the staying at home, and to what extent would you say? That's
a hard question to answer. Just like the slide that was shown, though, about 50% of cases that we've been able to try to make the connection on have been the essential healthcare workers and the congregate setting. And so I think at times there has been exposures that way, but on just a general basis, that's hard for me to comment on.
Okay, so part of the questioning, once someone's then decided they have this, that aren't those some of the questions though, or shouldn't they be, or?
They are, but when we talk to the general public, the exposure sometimes is, well, I went to Walmart and I didn't wear a mask, so that's a little bit harder.
Okay, or it might have been prior to the mask deal too. But, okay, all right. I just wondered if there was a correlation, if they were practicing the measures that are put in place and it wasn't working still. So
yeah, it's hard to say because the exposure at times, like if it's at work, then it's a little bit easier to know, but sometimes, we don't always know exactly when it is.
okay, thank you, Dan.
Mr. Akers.
Thank you, Mr. Chairman. So Dana, at this particular point in time, I mean, the comforting thing is, if there is any comfort at all, is that every case is connected. We do not have any random case like somebody that went to a store, whereas Walmart or whatever else, and they don't know how they got it. Everybody is somewhat connected. Would that be a true statement?
No, that is not a true statement. I would say about 90% of our cases we have a connection to, and we think we have the connection to, right? So, but there are a few cases that we're like, we don't have how they quite got it. I mean, there are a few, but it's just a few.
Okay. So on the testing, essentially you're going to have to test about 3,000 a month. Would that be correct?
That's what it looks like, yeah.
So 150 a day on a 5-day week, are we going to be able to attain that?
At this time, I believe the hospitals have been able to keep up with that. And Dr. Williams, you might want to talk about that, but I don't know as time goes if we'll be able to maintain it. I do think that we have put in, we would like one of the drive-throughs here that the state can help us with. So we're kind of waiting to see if that's something that we can have here as well.
So in a 12-month period, you'll have 36,000. So over a third of the population. I mean, how do you get people to sign up if they're not feeling ill or whatever? They don't feel that they've had any exposure. So how are you going to attain that? Mr. Williams?
Go ahead.
Dr. Williams?
So, I think what you're going to see, the testing is going to evolve, right? So, right now we have these testing centers where you need an appointment and so on. I think you're going to see some evolution. I think we're going to hopefully work with the state, have some more drive up type screening options. And then I think once the point of care testing becomes available, so those are the test kits that can be available in outpatient primary care providers' offices. You might even have a situation where the pharmacies are talking about being able to do testing. So the pharmacy at Walmart, the pharmacy at Kinney's, the pharmacy at Walgreens. So there's going to be increasing availability sort of throughout the community of testing, and testing where you can get the results, within an hour. So right now it's, you make an appointment, you get the test results back in 2 to 3 days. Testing is available in six places in the county. I think you're going to see much more available testing, much more rapid testing. So we're going to have to do that if we're going to be able to do the testing on the scale that's being described.
Okay. Thank you, Dr. Williams. Thank you, Dana. Dana, I also want to thank you for everything that you've done. I explained or made a comment at the last meeting about the work that you're doing, and it's like an iceberg. We see what you're doing on a 10% level with the reports that you're putting out on a daily basis, and I think that's been instrumental in keeping people wearing a mask and being careful around those that are vulnerable. But the 90% of the work that you're doing is underneath the surface when you're tracing down these contacts and everything else, and I just want to express our appreciation for that.
Mr. Reagan, did you have your hand up?
Yeah, yes, I did, Mr. Chair. Dana, how long do you expect it'll be until we've got the 35 contact tracers that the governor says we'll need?
Well, so tomorrow I have a training with all of the 4 colleges, and that started out with the health offices, and then some of the administration also was kind of interested. And that I think is a precursor to the conversation we're going to have with the colleges should be on the campus next year. And that's why more testing needed then too. And so more contact tracing, will be needed. Then on Wednesday and Thursday, I have 5 or 6 people each day coming to do the training. So I believe by the end of this week or by the end of next, just for sure, I think we'll have the 35 that we need.
And when will we hit the governor says we need 30 diagnostic tests available. When do you expect us to meet that threshold?
So I think we're pretty close to it now. Dr. Williams, can you expand on that?
Sure. I mean, I think if you look at that criteria, I think we're actually currently meeting it. Now, again, the testing is evolving, right? So in this past week, we've done, 500 or 600 tests in a week. So I think we can meet it. I think, again, we're going to need to work with the state. We're going to need to work with the pharmacies. We're going to have to expand it beyond just the St. Lawrence Health System in Claxton. But I think we're going to be able to meet the testing criteria, and that we already are.
Now, do we know of the 7 counties in the region, which ones are farthest from hitting the criteria?
I don't know that because as far as I know, those criteria just came out yesterday and today. And so I'll know more when I meet on Friday this coming week.
Okay. Thank you.
Anyone else? Ms. Arquette?
Dana, I'm just at the slide showed, you talked about the governor's phases that he implemented. Phase 1, construction, manufacturing, and retailers with curbside pickup, and then phase 2, professional services, etc. I've had some questions, and I'm sure we all probably have, about salons opening. And some salons that may be getting misinformation about when they are able to open. Can you tell me when you see them, which phase you see them going into?
Yeah, so actually this information just came today during the talk. So we have a call with the state on Wednesday and hopefully we'll get more information. That's really hard to tell if it's phase 2 or phase 4.
But certainly you wouldn't see them coming into phase 1.
No.
No. Thank you.
Yeah.
Anyone else? Ms. Terminelli?
Thank you. Dana, has there been any guidance given about how we'll know when we can move from one phase to the next? How is that determined?
That I'm not aware of yet. So the guidance has been slow to come. So like I said, we just learned what the categories were for phase 2, 3, and 4 just today. So I'm hoping this week we meet with the state to ask them questions on Wednesday, and we also have our NYSATO call on Thursday that we can ask questions. We also do submit questions to the state on a daily basis that are answered for us. So those are the types of questions that we're waiting for the answer.
Anyone else? Anyone else? Ms. Arquette?
Dana, excuse me if you've already answered this. I maybe just didn't hear, but I've had some questions about the follow-up process after someone is out of quarantine or isolation. How often they have to check back in with public health or their physician? Is there a follow-up test?
So if you're someone in quarantine, you have quarantined for 14 days from the last day that you had contact with the positive. So sometimes that's 14 days. Most times it's shorter by the time that we're talking to the person. If that person has any symptoms though, or they live with a positive, that time period gets kind of and so that's for isolation, like I mentioned, it has to be 7 days from the time that the symptoms onset. And then you have to have 3 days of no fever and once people meet those things, then we send a letter that says you are deemed to be done with quarantine or done just with the isolation process. So the follow-up after that, there really is none unless symptoms were to start again, things like that. Then if they were to recontact us, we would ask them to see their just the primary care doctor. But we don't usually clear anyone until they're symptom free.
Anyone else? Seeing none, Dr. Williams, Dr. McGuire, thank you. I think you can see that we all think that you are doing yeoman duty for the work that you're performing. I thank you very much for making yourselves available to be with us by way of video. It's very helpful. We do get a lot of questions. You help provide the answers. So thank you very much. And before we move on, I overlooked a couple of things that we have to do. I would entertain a motion to approve tonight's agenda by Mr. Curran, seconded by Mr. Arquette. Any discussion? Seeing none, all in favor?
Joe.
Aye. Aye.
To amend the agenda, remember?
Yes. And I would need an amendment, or excuse me, a resolution to amend the agenda to include the resolution that is the adoption of the CSE contract and authorization for the chair to sign that agreement. Second, by Mr. Arquette, seconded by Mr. Perkins, Mr. Fay, and Ms. Arquette. Any discussion? Seeing none, all in favor?
Aye. Aye.
Opposed? Carried. There are no communications. And so we will move on to the presentation of resolutions.
Joe,
Yes.
for minutes, we have to approve
Minutes.
the minutes.
Is there a motion to approve the minutes of the April 6th meeting by Mr. Denisha, seconded by Mr. Sheridan and others? Any discussion? All in favor?
Aye.
Opposed? Carried. Excuse my overlooking this, please. Now we will move to the presentation of resolutions with Mr. Denisha.
Thank you, Mr. Chairman. I offer a resolution modifying the 2020 budget for the Sheriff's Office for the purchase of uniforms and move for its adoption.
Is there a second? By Ms. Curran, Mr. Perkins, and Mr. Fay. Any discussion? Seeing none, roll call, please.
Haggard,
Yes.
Arquette,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe, Dave Forsythe,
Yes, sorry.
Lightfoot,
Yes.
Sheridan,
Yes.
Leader,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
15 yes.
Resolution is carried. Mr. Denisha.
Thank you, Mr. Chairman. I offer a resolution authorizing the chair to appoint the planning director, Jason Fotenhauer, the certifying office for environmental renewal as required by fiscal year 2019 CDBG Grant Award 1106 HR 363-19 and move for its adoption.
There's second by Mr. Fay, Mr. Perkins, and Ms. Terminelli. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried. Mr. Denisha?
Thank you, Mr. Chairman. I offer a resolution encouraging St. Lawrence County landowners to use marginal lands and to utilize the advice of the Soil and Water Conservation District prior to the sale of lands or when signing leases for large-scale solar arrays, and move for its adoption.
There's second by Mr. Forsyth, Mr. Akers, Mr. Burke. Any discussion? Mr. Akers?
Thank you, Mr. Chairman. I just want to point out that across the nation, for every hour that goes by, we're losing about 40 acres of tillable ground. And as the population is expected to double by the year 2050, we're going to need all the food that we can get. We're going to need 100% more food. So it's very vital that that this resolution and that people at least try to adhere. More importantly, the energy companies that are or the investors that are looking to establish solar or wind in our county, that we encourage them to use marginal land. Thank you.
Thank you. Anyone else? Seeing none, all in favor?
Aye.
Aye.
Opposed? Opposed? Carried. Mr. Denisha?
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with New York State Office of Community Renewal for the Community Development Block Grant Funds, and modifying the 2020 budget for the Planning Office, and move for its adoption.
Is there a second? Second by Ms. Terminelli and Mr. Perkins. Any discussion? Seeing none, roll call, please.
Nancy Arquette,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran, Rita Curran, Reagan,
Yes.
Rita Curran,
Yes.
Forsythe,
Yes.
Lightfoot.
Yes.
Sheridan,
Yes.
Leader,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
15 yes.
Resolution is carried. Mr. Denisha?
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with New York State Department of Transportation for public transportation services, and move for its adoption.
Your second by Ms. Terminelli and Ms. Curran and Mr. Arquette. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried. Mr. Denisha?
Mr. Chairman, I offer a resolution authorizing the chair to sign contracts requesting grant extensions for poll worker training, voter education, and modifying the 2020 budget for the Board of Elections, and move for its adoption.
Is there a second? By Ms. Curran, Mr. Arquette. Any discussion? Seeing none, roll call, please.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Leader,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Arquette,
Yes.
15 yes.
Resolution's carried. Mr. Denisha?
Mr. Chairman, I offer a resolution authorizing the chair to sign Have a Shoebox contract extension with New York State Board of Elections and move for its adoption.
Seconded by Ms. Curran, Mr. Perkins, Mr. Arquette, Ms. Arquette. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Sheridan.
Thank you, Mr. Chairman. I have a resolution modifying the 2020 budget for Public Health Department to accept an Excelis Blue Cross Blue Shield BCBS Community Health Award, and I move for its adoption.
For a second. Second by Mr. Akers, Ms. Curran, Mr. Forsythe, Ms. Terminelli. Any discussion? Seeing none, roll call, please.
Tony Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Leader,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Arquette,
Yes.
Burke,
Yes.
15 yes.
Resolution is carried. Mr. Sheridan.
Mr. Chairman, I have a resolution authorizing the chair to sign with Health Research Inc., HRI, for COVID-19, modifying the 2020 budget for public health and for its adoption.
Is there a second? Second by Mr. Denisha and Ms. Curran and Ms. Terminelli. Any discussion? Seeing none, roll call, please.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Leader,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Arquette,
Yes.
Burke,
Yes.
Arquette,
Yes.
15 yes.
Resolution is carried. Mr. Sheridan.
Chairman, I have a resolution modifying the 2020 budget for community services for funding from New York State opioid response, and I move for its adoption.
Is there a second? By Mr. Akers, Ms. Curran. Any discussion? Seeing none, roll call, please.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Leader,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Arquette,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
15 yes.
Resolution is carried. Mr. Sheridan.
Mr. Chairman, I have a resolution authorizing the chair to sign a memorandum of understanding with Alcohol and Substance Abuse Council of Jefferson County, DA, Pivot, to implement the triple P positive parenting program, and I move for its adoption.
Is there a second? By Mr. Perkins, Ms. Terminelli, and Mr. Akers. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried. Mr. Sheridan.
Mr. Chair, I have a resolution modifying the 2020 budget for community services for funding received from New York OASAS for pass-through funding to approved agencies. Move for its adoption.
Is there a second? By Ms. Curran, Mr. Akers, and Mr. Perkins. Any discussion? Roll call, please.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot.
Yes.
Sheridan,
Yes.
Leader,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Bay,
Yes.
Haggard,
Yes.
Arquette,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
15 yes.
Resolution is carried. Mr. Sheridan?
Mr. Chairman, I have a resolution proclaiming May as Older Americans Month with the 2020 theme being Make Your Mark. I move for its adoption.
Seconded by Mr. Denisha, Mr. Forsythe, Ms. Curran. Any discussion? All in favor?
Aye.
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 Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer for a resolution of modifying the 2020 budget for the Workforce Innovative and Opportunity Act for the fiscal year 19 wheel budget to transfer formula funds from dislocated worker accounts to adult accounts. I move this resolution.
Is there a second? By
Second.
Ms. Curran, Mr. Fay, Mr. Arquette? Any discussion? Roll call, please.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Leader,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Bay,
Yes.
Haggard,
Yes.
Arquette,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
15 yes.
Resolution is carried. Mr. Akers?
Mr. Chairman, I offer a resolution proclaiming the week of May 3rd through the 9th of 2020 as Correctional Officers and Correctional Employees Week in St. Lawrence County. I move this resolution.
Is there a second? Second by Mr. Sheridan, Ms. Curran, Mr. Reagan, and Ms. Terminelli. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution proclaiming May 15th of 2020 as Police Officer Memorial Day during National Police Week in St. Lawrence County. I move this resolution.
Your second by Ms. Curran, Ms. Arquette, Mr. Reagan, Mr. Burke, Mr. Denisha, Ms. Terminelli,
Sheridan.
Mr. Sheridan. Is there any discussion? Mr. Arquette?
Sorry, Mr. I wanted to be added as a co-sponsor. Thank you.
So noted. Anyone else? All in favor of the resolution?
Aye.
Aye.
Opposed? Carried. Mr. Akers or Ms. Arquette? Your choice, Mr. Akers.
Mr. Chairman, I'd like to offer this to Ms. Arquette. This is her resolution.
Thank you, Mr. Akers. Mr. Chairman, I would like to present a resolution proclaiming May as National Foster Care Month. I'd move this for its adoption.
seconded by Mr. Arquette, Ms. Terminelli. Are there any, or is there any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution modifying the 2020 budget for the Department of Highways for CHIPS revenue rolled over from 2019 to be used for paving projects. I move this resolution.
Is there a second? Second by Ms. Denisha, Mr. Forsythe, Mr. Denisha, Mr. Forsythe, and Ms. Curran. Excuse me, Lawrence. Is there any discussion? Seeing none, roll call, please.
Lightfoot,
Yes.
Sheridan,
Yes.
Leader,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Hager,
Yes.
Marquette,
Yes.
Burke,
Yes.
Marquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
15 yes.
Resolution is carried. Mr. Akers?
Thank you, Mr. Chairman. I offer a resolution approving federal and highway project for the engineering and design and right-of-way for the County Route 35, parentheses, Slab City Bridge over Trout Brook, bin number 3341-700, pin number 775394, and modifying the 2020 budget for the Department of Highways. I move this resolution.
Is there a second? By Ms. Curran, Mr. Fay, Mr. Perkins, and Mr. Forsythe. Any discussion? Mr. Akers?
I would just like to say that the projection for this project could be anywhere from the year 2022 to 2023. Conversation with Mr. Chambers today.
Anyone else? Seeing none, roll call, please.
Sheridan,
Yes.
Leader,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Hager,
Yes.
Marquette,
Yes.
Burke,
Yes.
Marquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
15 yes.
Resolution is carried. Mr. Akers?
Mr. Chairman, I offer a resolution modifying the 2020 budget to share occupancy tax with the St. Lawrence County Chamber of Commerce as prescribed in the 2018 to 2020 agreement. Tourism promotion. I move this resolution.
Is there a second? Okay, Ms. Curran and Mr. Arquette, Mr. Fay. Any discussion? Mr. Forsythe?
Yeah, Ruth, do you know what the plans, if any, are for the additional funds the chamber plans on using this for?
I can tell you, Dave, that Brooke will be joining us at finance. And she can line that out for you as well as talk about their plans for the upcoming season.
Yeah, because I'm just thinking about that amount of money, plus it doesn't sound like there's gonna be fishing tournaments that, not the way they used to be at least, so I just wondered the timing, but thank you.
Yes, I can ask her to bring that.
Anyone else? Mr. Denisha?
No, I did not have a question, Mr. Chairman.
Okay.
I'm just scratching my head.
Anyone
again.
else? Seeing none, roll call, please.
Leader,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Hager,
Yes.
Arquette,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
yes,
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
15 yes.
The resolution is carried. Mr. Akers.
Mr. Chairman, I offer a resolution establishing a standard workday for New York State retirement system reporting purposes. I move this resolution.
Is there a second by Ms. Curran? Any discussion? Seeing none, all in favor?
Aye.
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 Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution accepting donations from the Orange County Emergency Operations Center, the EOC, during the coronavirus pandemic and modifying the 2020 budget for the Board of Legislators. I move this resolution.
Is there a second by Ms. Curran and Ms. Terminelli? Any discussion? Seeing none, roll call, please.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
May,
Yes.
Haggard,
yes,
Arquette,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
yes,
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Leader,
Yes.
15 yes.
Resolution is carried. Mr. Forsythe, will you present the next resolution, please?
Yeah, Mr. Chair, I'd like to offer a resolution authorizing to provide county employees with flexibility for the option to assess vacation, buyback of accruals, and extend personal time accruals during the COVID-19 response, and move for its adoption.
Is there a second? Second by Mr. Arquette, Mr. Burke, Mr. Perkins, and Mr. Reagan. Is there any discussion? Mr. Akers.
I'd like to ask Ms. Doyle what the cost would be, and then if that cost would actually, if there are monies that are going to be eligible from either federal or state to cover this COVID expense, would they qualify?
Can I answer, Mr. Chair? Can I answer?
I will hope to answer that question for you. I don't know if you were able to read through the email that Ruth sent out about this, or if I was the only one to get it. But what it does is it makes available for them to utilize time off and personal time that they, or vacation time, that they were unable to use because of this COVID deal, and because they were, in most cases, designated as essential employees. They had to be there. So to have them suffer a loss because of something that they were mandated to be at by us here in the county doesn't seem like the right thing to be doing. Therefore, that's the purpose of this resolution, is to allow those people affected to be able to use those accruals for the most part up to either the, I believe, the end of July or to the end of the year, depending upon the type of leave.
Mr. Chair, can I answer Kevin's
Yes.
question as well? Legislator Akers, the maximum cost, so this is not a required benefit. If folks would like to access it, they can. But looking at the folks who, over this period of time, will reach their maximum benefit, the maximum cost would be $156,000. And with the personal time, which is not something I was able to review in detail when we talked about this, this looks at the folks with anniversary dates of May and June, and it just avails them. We don't pay out personal time, nor would we look to. But this cost associated with extending the availability of personal time until the end of the year would be about $9,900 or just under $10,000. And I don't know yet the answer to the FEMA question, but I'm happy to pose it.
Okay, thank you. I do support the resolution. I know what the resolution, I just wanted to know the cost, and you've answered those questions. Thank you.
Anyone else? Seeing none, all in favor?
Aye.
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 Opposed? Resolution is carried. Mr. Reagan. So authorizing the vacancies, James.
Yes, Mr. Chair, I'd like to offer a resolution authorizing the filling of vacancies. I move the resolution.
Is there a second?
Second.
Seconded by Mr. Forsythe and Mr. Sheridan and Mr. Arquette. Any discussion? Seeing none, all in favor?
Aye.
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 Opposed? Carried. We will move on to the county administrator's report.
You have the additional
Excuse me.
resolution. Yep.
I forgot the last resolution. The last resolution is a resolution authorizing the chair to sign a contract with the Civil Service Employees Association, Local 1000, Unit 8400 for 2024. Mr. Perkins, would you move that, please?
Yes, I would.
Is there a second? By Ms. Curran, Mr. Fay, Mr. Akers, Ms. Terminelli, Mr. Denisha, Mr. Arquette. Mr. Burke, do you want to join in?
Yes.
All right. And Ms. Arquette, is there any discussion? Mr. Perkins.
Yes. I'd like to thank all the people involved in this. This is my first time being involved in negotiations like this. It was very interesting, a lot of back and forth. There was a lot of hard work put into this. I think it's a very fair contract, and I support it wholeheartedly and hope everybody else does. Thank you.
Thank you. Mr. Akers?
I was just going to echo, Rick was the chairman of this committee. I think we went back and forth. It seems like forever, maybe 5 to 8 times. Fortunately, Johnny Dorothy brought the chocolate to keep us all satisfied. But it was a back and forth, and it is a reasonable contract. Is it possible that we know the vote total, or can that be revealed, Mrs. Doyle? Of support?
I'm not sure that can be revealed or not, but I know that it was voted through with a convincing margin.
Okay. So thank you very much, and thank you, Rick.
Thank you. Mr. Forsythe?
I'm good.
Very good. Did somebody else have their hand up? Okay. I too would like to thank Mr. Perkins. He ran those meetings like he'd been doing it for years. They were not easy. It was not fun, but we were able to smooth things out, come to an agreement. And I think a lot of that had to do with his leadership. So I thank him very much. That being said, any further discussion? All in favor?
Aye.
Aye.
Opposed? Carried. Now we will go to the county administrator's report.
Yes. A few items I wanted to share with you tonight. I wanted to talk with you about the EOC operations. So today is day 50 of operations since the EOC was activated, and it's day 41 since our first case. You heard from Dr. Williams and from Dr. McGuire tonight. Dr. Williams provided the last week average, which has been 1.7. So we certainly are seeing things trend in the direction that we'd like, but we are not certain, and at any moment, you know, that could change. But considering that on May 15th, the state of emergency will expire, I wanted to also talk with you about potentially, should things remain the same, of allowing that to expire with full understanding and contingency to re-declare if the numbers change. But also that would mean for the Emergency Operations Center to cease operations over the weekend. So staff have been here, between Dylan and I, we are here on the weekends, and the staff is here as well. What we'd like to do is return, if you recall, back to a Monday to Friday operation during business hours. Certainly, we're available to accept donations as we receive state shipments. Those are organized. Many of you have been very helpful in making those distributions when the state shipments arrive or making those contacts. But if there's no objection to that, when the 15th arrives, which would be a week from Friday, we will resume the operations at the Emergency Services Department. That would mean this weekend, there would be no Emergency Operations Center open, but certainly we're available to answer questions and help the folks. They will forward the lines across the street. So I want to get a little feedback on that if there are any questions. Okay. As you've just adopted, we will be recognizing this week correction officers and correctional staff. As you all know, this is challenging work that the sheriff brings to you through his staff, but especially in these environments. And I would like, as I've requested recently, permission to provide them all their shifts with some type of meal during this week, likely towards the end of the week. And next week, as that will be police officers recognition, to recognize our deputy staff, both civil and criminal as well. So I would like permission to do that with the Employee Recognition Program funds. I do want to mention that certainly in St. Lawrence County, the concerns associated with folks attempting to receive unemployment have been staggering. I think that's shared across the state. And we've had conversations both at this level as well as with our state representatives to try and free up that bottleneck. And I believe that they're working on it. I believe that they are overwhelmed, and I think that they've provided us with some information that we'll post on our homepage. But what they were talking about today was about not only the submission of the application, but the certification of continued unemployment. And so I think that's something that we need to get out in the message as well about that additional step. Not that that is the bottleneck, but I think it may be part of it. So any way that we can help the public trying to access those benefits, we will do, and we'll post some information on our website to do that. Also just wanted to follow up on the COVID task force that was walked through tonight by Dr. Williams and followed up by Dana with the phases. Certainly that applies to county government as well. And there's a variety of services, just probably as many likewise in the county, of different services we provide. And we want to schedule a very careful reopening in accordance with those phases. So we will follow the lead of Dana and Dr. Williams, but I've reached out to our partner agencies in the IDA, in the Chamber of Commerce, in the Cornell Cooperative Extension, as well as Soil and Water Conservation District, because there's an ag component as well, to provide assistance through this process so that we can have an open line of communication with our businesses to make sure that we address their needs through this process. We can put a great plan together, but if it doesn't work for the folks that we intend, it's not a very good plan. So our intent will be to engage all of those folks, but also to carefully consider the scale up of our services. And as you recall, in Executive Order 202.4, and then echoed in 202.14, and then 18, the 50% reduction in office density is continued until May 15th. So what we'd like to do is to be able to look at when those regulations in the executive order are relaxed and ultimately removed, that we scale up appropriately to consider the risk in the type of work that we do, but also to make services available to the public. And certainly in places like the Department of Motor Vehicles and in the county clerk's office and a variety of others, they are going to see a great deal of need once they open on any level. So careful consideration, as you know, social services has continued to meet the need and to take appointments and meet with folks as needs require. But the variety of departments will need to carefully consider how to best do that in a manner that preserves employee safety as well as safety of the public. And I think with the scale up plans and the reopening efforts, I think we need to have more contingencies than we typically do in any of the plans we put together. And by that I mean, should we see a spike in the number of cases over a number of days, we need to have plans for how we will handle that, how we will scale back, or how we will, again, pause until we get that under control. So those are things that I think if we don't plan ahead for what those triggers look like, we may quickly be into a difficult situation once again. I do want to mention that we have vacancy review scheduled for tomorrow, and there is only one vacancy to be reviewed. So that should probably be one of our shorter meetings. And finally, as you adopted additional highway funds at this meeting, there will be, I believe, 2 more projects brought to you for consideration at Finance. Are there any questions? Dave has his hand up, I think. You see Dave? Mr.
Forsythe.
Ruth, thank you. Regarding the DMV sites, a lot of the places have gone to plexiglass. I know that the Ogdensburg site and I believe the Canton site don't have any involved directly in front of the staff at the satellite locations. Are we planning on any renovations to update that, or what's the thought process?
That actually has come through as a new requirement prior to reopening and allowing the public to come in. So those rather inexpensive renovations are already underway.
They're already being done. Okay, good.
Yep. You're welcome.
Mr. Burke.
Ruth, you touched upon the COVID and what you plan to do with our employees. I guess I'm wondering, is there, we certainly talked a lot about mitigation as it relates to the disease itself. And I know that Joe and others have been involved in an effort to look at the business end and the individuals that are impacted by this. I guess I'm just wondering if is there any measure that we have that can tell us just what the degree of suffering is, and if there's anything that we can do as a county to mitigate the suffering of people who have been weeks without a check or unemployed, as well as the businesses that are suffering greatly. Just wondering, I don't have any great solutions other than maybe a hotline, so that at the very least, somebody who hasn't received a check in weeks, we should be opening the doors for social services and whatever else we can do.
Absolutely, John. And I think part of the dialogue with Patrick Kelly has been just that, how we get a handle, in the vein of economic development, but also in this case, economic recovery, of how many businesses are going to be in need, how many of those businesses have applied for assistance, and in turn, their number of employees. So he's agreed to participate and pull some of those kinds of data points that would be helpful. I think that it's safe to say St. Lawrence County, more than our neighbors, with the numbers that we've seen, have been impacted to a greater degree. And I think the challenge of suffering is going to be much longer than this concentrated time. It will go on for a long period of time. So any way that we can meet the needs, social services has been very busy. And I think that part of the challenge they face is the extended period of time we're going to be dealing with this in the variety of ways, not just in temporary assistance and SNAP benefits, but also in some of the interventions that are necessary. So I think that is one of the main reasons that county government is here, because those services continue in times of unemployment like this. But we'll see what we can get.
And I just another suggestion, if I may. Chamber of Commerce, they are in a unique position to have their finger on the pulse. Maybe we could ask them to take some measures as well. And I think, as far as the possibility of a hotline, I mean, where do businesses go that may not know where to turn? Where do individuals go that may not know where to turn? I'm sure our elected state and officials and some of us have received phone calls, but it would be nice to have,
some individual, whether it's a hotline or some entity that could field some of those calls and make referrals and hopefully link people up with the help that they might need.
Understood. And Brooke and her team have already agreed to participate as well. So I think we have some great partner agencies that have their thumb on the pulse and also have great means to get more information. So that's certainly something to look at, John.
Thank you.
And Mr. Chairman?
Mr. Forsyth.
John, I think once the unemployment numbers for the next month or so come, and then the sales tax figures come in, I think that'll be a pretty good indicator. Patrick Kelly reached out to me today. Apparently there's been 60 billion finally released for agricultural and farming related small business loans that had been kind of set aside, and that took effect today. So he's reaching out with his staff to any type exposure to see if there's any low interest loans, if anyone's interested in receiving or helping. I thought that was a nice call. I had no use for it, but he's reached out to, they're reaching out to quite a few people. If anyone knows anyone, steer them towards Patrick, because what I found with the PPP, the small business loans, is that money goes fast. So once the word's out, it seems to go pretty quick. So you wanna get in there.
Great suggestion.
Anyone else?
Joe, I just have one more update.
Okay, go ahead, Ruth.
I can share the total of the vote associated with the contract, and that was 225 yes and 27 no. That's all I've got unless there's other questions.
Any questions? Mr. Perkins.
Yes, Ruth, I'd like to thank you for the update on the unemployment and the efforts with the state. I've been receiving quite a few phone calls of people who have not received any unemployment as of yet, and they're hurting. So I ask you to continue on those efforts with the state, or anything you can do, and I appreciate everything that you have done. Thank you.
Thank you. All right.
Oh, I have one more, sorry.
Okay.
Lastly, I promise, I have one transfer of funds pursuant to local law C of the year 2011. I report any transfer of funds to you at the next meeting, and there was $363.76 transferred to probation for document shredding. And that's really all.
Any questions?
I do have one more.
Go right ahead.
New York State Insurance Fund put out a notice today that on the workers' comp for employees that aren't working, that are getting paid, they're letting you, at least the private industry, I'm not sure if it's the same with municipalities, put the classifications at the clerical code, which is a lot cheaper. I'm not sure if that's the same thing we can do at the county. Maybe something.
Mr. Perkins, we're currently in the portion of the year where we start to prepare up the apportionment numbers for the board to vote on that will be distributed. If you'll recall, our algorithm is set on a 3-year look back. So while it'll have an impact, I don't anticipate that it'll be a significant impact, but part of our algorithm formula actually has the insurance rating codes, the IRCB codes that are incorporated into it that give a certain value so that we can come up with a dollar amount per employee, per plan participant. So we are aware of that. We are aware that we can utilize the administrative or clerical code associated with certain of these employees right now. Thank you.
Thanks.
Anyone else? Okay. Seeing that, are there any committee reports? Seeing none, is there any old business? Is there any new business? I have one item for new business. We here on the board don't often get letters like this. I got a personal letter from an employee on Friday, and I'd like to share a portion of it with you. It says, "Hi, Joe. In these so terribly challenging, traumatic times, I just wanted to express my gratitude for my job here at DSS. I, like many of my coworkers, managed to pay our bills and spend dollars in our communities. I am deeply troubled by the division we are experiencing, not only nationwide, but locally as well, regarding the loss of jobs and income facing our city and county residents due to COVID-19. I am truly grateful for my job, and I'm concerned that some believe that it might be helpful economically to cut positions. I am hopeful that more decision makers will appreciate that losing even more jobs will only hurt the local economy. There's more to it, but that is to the point. And I thought that you would appreciate it. I do. So before we go into executive session, and I entertain a motion for that, if I could be allowed to sort of jockey the positions here, where I would like to take up personnel first, followed by litigation, negotiations, and appointments. So unless there's objection, I would do that. Is there any objection?
No.
All right, I would need a motion to go into executive session by
So
Rita
moved.
Curran and seconded by Dave Forsyth. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Back in open session. Mr. Denisha, will you go through the appointments, please?
Mr. Chairman, I offer for appointment to the Fair Housing Task Force, term to expire 12/31/2023. Annette Bowman of Canton, New York. And I offer for appointment, for reappointments to the Environmental Management Council, terms to expire 12/31/2021. Catherine Bennett Hubleton and Pat Whalen Messina. And I offer appointment to the Fair Housing Task Force, terms to expire 12/31/2023. Michael J. McQuaid, Gouverneur, New York, and Diana Dufresne, Messina, New York.
Is there a second on these? By Mr. Arquette, Ms. Terminelli, and Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer for appointment to the St. Lawrence County Ethics Board for a term to expire on December 31st in the year 2025. Cheryl Shatra of 303 Chapman Point Drive in Morristown, New York. I would move for her appointment.
Is there a second? By
Second.
Mr. Denisha, Ms. Curran, Mr. Forsyth. Any discussion? All in favor?
Aye.
Aye.
Any opposed? Carried. I will be making these appointments tonight. Legislators Perkins, Nancy Arquette, and Reagan to a committee to work with the public health in the formation of protocols and procedures with respect to the COVID recovery that are in compliance with the edicts of the state of New York. So wish you well. It's a well-worthy committee to be on, and I trust you'll all do a great job like you always do. Is there a motion to adjourn?
So moved.
Second.
We are adjourned.